Hello viewers, I'm very super excited for today's topic because the topic is the most common enemy of the human race, and that is diabetes. As you know, diabetes is very rampant all over the world. It is so rampant that the statistics say over 500 million patients have diabetes, and this I am telling you 2018 data. Now we are near the end of 2019, and probably 2020 is very near. So we should not discuss this data of 2018, but over 500 million diabetics all over the world. So why so rampant? One is it is not treated, first of all. Second is the lifestyle we are following, the disease method suppressions we are doing, all are contributing to increasing prevalence of diabetes. We have seen some incredibly different results with diabetes. But then let me discuss about the diabetes first. So now 500 million diabetics all over the world in 2018. By 2020, it is almost assumed that every 1 out of 8 person will have diabetes, either a pre-diabetes or a diabetes. But then he will be in a diabetic medication range. Over the future 10 years, it is assumed that out of every 4 to 5 patient, one will be diabetic for sure. Now this is not a good data. Probably everybody is at risk, including you and including me. And those who are diabetic, they have a higher risk. So most of the people are usually happy and contented to take 1 or 2 tablets, and they say, oh, my blood sugar is okay and my blood sugar is right. Let me tell you guys, this is not a treatment. This is not a treatment. It is just a control of the report and the reading. So the control of report and reading is actually misguiding you. It is actually misguiding you, and you believe, okay, my reports are okay, so I will not get any complications. Let me tell you, this is wrong. When reports are okay, see, there are 2 types of complications, microvascular and macrovascular. 2 types of complications. Only macrovascular complications can be slightly taken care of by the control of blood sugar, but rest of the things are not taken care of, and you are into the same risk of getting the complications. So now let us discuss about the risk associated with diabetes. The first and the foremost risk which I usually prefer to discuss is the 100% guaranteed risk. Now what is this 100% guaranteed risk? Usually the drugs used are sulfonylureas and biguanides. Most of the people are taking the similar kind of a medicine. So if you are taking any of these medicines, your pancreas are failing daily. Your pancreas are failing daily, and your beta cells are getting exhausted daily, and you are heading towards pancreatic cell failure. You are heading towards pancreatic cell failure. Now, as you are step by step heading towards pancreatic cell failure, you are bound to get on insulin. And people worry, sir, I have taken medicine for 20 years, but now doctor suggested me to go on insulin. He suggested it right, because your pancreas has stopped responding even to those strong medication, even to the increased dose. And doctor advised you rightly that you need to take insulin. At that moment, probably you will not be able to lot many things. But before that, maybe at this moment, or maybe at the moment when your diabetes just started, or it is midway, or it is 2 years, or it is 3 years, there is a lot to do, which we avoid. In India, probably globally as well, people will try to act only in emergency. Till then, they will procrastinate, they will delay and delay and delay. And when they delay this much, so much that the complications have eventually started, then they wake up, oh my God, what happened? And then they search for some alternative medicines or something like that. Now, this is not a good scenario. But the first complication will happen if you are even in the most regular medication. Probably it happens more to those people who are in most regular medications. Nowadays, there are some medicines which reduces the risk of pancreatic beta cell failure, but still the risk is there. Second most important risk. Recently, I was in Singapore. So I was very curious about Singapore having lots of kidney failure dialysis units. I was wondering, one of the world's most developed nation, developed in medical practice, why so many kidney units? The reply came, Singapore is full of diabetes, and the two biggest complications which Singapore often have from diabetes, one is kidney failure. It is rampant everywhere. Now just imagine, guys, in a country with a highly developed, medical facilities, kidney failure is so common. Means kidney failure cannot be prevented by just having the control of blood sugar. One. Second thing which is very, very common in Singapore is gangrene and amputation of legs. Now guys, this is scary. When I was there, it was very, very common in a metro, or whenever I was waiting for a cab or traveling through a cab. Almost in every round, I seen at least one amputation. It was not good sight to see. With this promotion, why we are promoting all these things? Because we want to prevent you from the complications. We want to save you from the complications. So the commonest complication after beta cell failure is a complication which nobody understands as a complication. It is a hidden complication. Your pancreas are gone by then, your beta cells are not working, they have exhausted beyond a limit, and they will not respond to whatever you do and whatever you try. Next complication, kidney failure. Now kidney failure is so rampant all over the world. Before, if you go 20-25 years back, there were hardly few units of dialysis. Now everywhere there are dialysis units. In fact, most of the social organizations feel pride in starting the dialysis units so that they can give some economic benefit to one who is already suffering from kidney failure. But here is my appeal to all the social organizations. If you really want to help people, please help them before their kidneys get failed. See, starting dialysis units to help them is great. It is a great job. But I think the more noble job will be to do something so that their kidneys will not fail. Now this is my effort to prevent the kidney damages and prevent the complication of diabetes, so that this message, this video reaches to as many people as possible. And I am sure you will also like to make people aware about what are the complications and risk with diabetes and what are the solutions. I will be telling you what we do at the end, just 5 minutes. But I want you to understand what are the known risks and what are the unknown risks. So first I told was a beta cell failure, a unknown, underestimated risk. Then a common known risk, kidney failure. Third, let us go with the Singaporean standards. The third is amputation. See guys, if somebody gives you a deal, okay, I am going to give you 1 crore rupees and you give me one of your legs. How many of you will give your leg for 1 crore or even 2 crore? Nobody, right? But then diabetes takes that. Diabetes takes away your most precious things from you, and that is your leg. You will have a prosthetic leg or you won't be able to walk. And the pain it gives, the mental torture, the mental pain it gives can never be calculated. So this is another big risk. I'm talking of the most developed country because this will help you understand that when a most developed country with the most developed medical science, is not able to solve the problem of prevention of complications, how can anybody else does, especially in a country like India? So we cannot depend on the same science which is not helping anybody prevent complications. We need to be more prudent. We need to be more wise if you really want to save yourself from these kind of complications. Now I will be shifting from the known complications and unknown calculated complications, uncalculated. I will be shuffling between the two because I want to have you enough understanding what kind of problem it can cause. Let me check who are there with you. मेघराज उपाध्याय जी, आपने बहुत सही समय पर सवाल पूछा. Ankylosing spondylitis, we are doing a genetic based treatment in all the diseases, and ankylosing spondylitis being autoimmune and genetic disease responds great. We are seeing probably maximum patient all over India, and also we have global patient of ankylosing spondylitis, right? So okay, coming back to some unknown, underestimated, unknown, uncalculated, unmeasured side effects. See guys, before having diabetes, you are enjoying everything. You are enjoying the parties with friends, you are enjoying the parties with families, you are enjoying all the liberty which your tongue can take and all the lavishness of the food. After diabetes, it ends. After diabetes, all this lavishness and liberty ends, and then you suddenly get so many restrictions. Do you think these restrictions affect your life? Yes, they do. First of all, they take away the charm from your life. That, oh, I'm into so many restrictions, I cannot do this, I cannot do that, I cannot go to parties, I cannot eat this, and somehow it works on your mind and you become more anxious about the complications, or you may become sad and depressed. Now these nobody calculates under the heads of complications of diabetes, but I will say this is the more important complications because you have stopped enjoying your life. The most you do is go on Google, search for diabetes, search for cure for diabetes, search for complication of diabetes, and search for the best doctor of diabetes and doctor video about diabetes cure, diabetes treatment. So everything in life changes. And guys, I believe your life is precious. I believe your life is meant for something else rather than searching for diabetes medicines, diabetes doctor, diabetes complications, diabetes risk, and diabetes cure. So it completely shifts the focus of your life. Also, it spoils relationships. Now, as I want to spoil relationship, it will spoil relationship by changing your mind to sad and depressed mood. One, and the most important thing, it causes sexual complications. Yes, the libido goes down, the erections goes down, especially males feel the heat of this complication because they become impotent gradually, and they feel the erectile difficulty, sexual problems in going with the orgasm. There are so many complications, balanitis happening, the infections happening, and the erectile dysfunction happening. So all these complications screw up their life. Now once even the male has a problem or a female has a problem, the both will suffer. So diabetes is a disease in which directly both will suffer, both partners will suffer because of the sexual complication and erectile dysfunction people suffer from. Now this is very sensitive matter, and I am sure very rarely we will get anybody asking question on this. But if you want to ask any question on this, let me tell you, there is a solution. We have an answer. All sexual problems can be reversed. And if you really want to ask some questions personally, I will give you my personal email ID. You can write it there. You can share all your problems, and we will see whatever best can be done for you. Right? Yeah, Abhijit, thank you. In fact, let me tell you, Abhijit, you are so inspiring. We are really enjoying. We got your message yesterday, today itself. It was fabulous. Thank you for that. So the sexual complications happen even in females. In females, the frequent infections are the first thing to interfere with the normal sexual functions. The frequent infections and some kind of recurrent boils and cellulitis and abscesses are very common phenomena, and that will also interfere with the sexual functions. Moving away to the more bigger diseases, cardiovascular disease, heart disease. Now, guys, even if you control this blood sugar to the best, you will usually see something else starts coming up. For example, you are taking care of your blood sugar, but then the cholesterol starts rising. Then as the cholesterol starts rising, you add a medicine for cholesterol. And then as the cholesterol starts rising, you see high blood pressure is there and the blood pressure is rising. With this, all the combination of all these three, the cardiovascular complications start appearing. The heart gets involved, and diabetes is one of the most common precipitating cause for heart diseases and coronary artery diseases. And once heart gets involved, there is a series of ECGs, angiographies, and treadmill tests, and angioplasty, and then bypass, then again angioplasty, bypass, angioplasty, bypass, angioplasty, bypass. Now, people usually wait for these complications to happen. I will not advise them to wait till this long, because it can be reversed. It can be reversed before many years. But the question is, how many of you are prudent enough to take the steps before emergency comes? Most will try to delay till the emergency comes. And let me tell you, it is not a wise decision. It is not a prudent decision. So please, guys, share this video to as many people as possible so that people understand that the best way is to reverse disease right now, so that you save all your organs. The next important organ to get involved is your eye. Now, eyes are precious. The world is beautiful. There are so many beautiful people around. Nature is wonderful. The seasons are coming and going. There are wonderful, beautiful colors. And the feeling we get by seeing the flowers, the beautiful flowers, the wonderful gardens, beautiful scenery, and so many beautiful things to see. Diabetes will affect your eye, may cause blindness, may snatch away this beauty of your life, may snatch away the happiness of your life, may snatch away the wonderful feelings you can get by your eyes. And eyes not just see the wonderful feelings, they see everything as they are. You can save yourself from more harm or any harm or accident just because of your eyes. So guys, preserve your eyes. I request you to preserve your eyes by treating diabetes as and when you get this video. Don't just control, try to reverse it, try to finish it, so that you never ever get the complications. Is it possible? Yes, it is possible. Another important organ which is damaged by this giant enemy is your brain. It is not just the brain, it is actually the vessels, the coronary arteries, the cerebral arteries and the brain, both are involved separately. With the arteries getting involved, we get stroke, paralysis, brain hemorrhages, and with the brain getting involved, we see more of a dementias, Alzheimer's, and all other brain diseases, including the brain infections of meningitis and so on and so forth. So paralysis can obviously finish your life, and it will be difficult for a normal person to enjoy paralysis. Nobody else can. Why to wait till you get paralyzed? Better take step well in time. So now let me see if some questions are coming up. Mr. Anup Burman, precautions to keep our pancreas. Mr. Anup, the best precaution is give him right treatment, dear. Your pancreas is sick. It needs help. Don't just beat up your pancreas to secrete more insulin. It is already sick. Beating a sick pancreas is not a good thing anyway. Is Kim Brin? Hello from Australia. Hi Kim. Hello from India. So good of you to share your time and knowledge to help you so many. Thank you. Thank you, Kim. We are actually treating all over the globe. We have patients all over the world, and we see patients from this London, New York, Los Angeles, Singapore, Dubai. So therefore, I try to go with the English language as only, so that I can meet with you, the Kim, and nice people like you. So thank you, Kim. Thanks for your inspiration. So now moving ahead with the diabetes. Now this is something which everybody must understand. Diabetes can completely distort or kill your career. Just an example, and this is a real example. There was an enthusiastic guy who was very supercharged to do something great in life, and he was hardly 20 years of age, and then he got diabetes. As he got diabetes, he was put on insulin directly because it was type 1 diabetes. Now, as he was put on insulin, his complete psychology changed. It was a 360 degree shift. The guy who was completely focused on his goals shifted his focus on diabetes. Now, there was nothing else in his life than the diabetes. The cure of diabetes, the gene of diabetes, the control of diabetes, the complication of diabetes, the risk of diabetes. So many people die of diabetes, the prevalence of diabetes, so many things happening around. He completely lost the focus. And then there was no goal. There was no focus. Everything was everything was blank. Everything was blur. What happened exactly? He was supercharged. He was going to achieve whatever he wanted to. But what happened exactly? Simple. Diabetes snatched all the dreams and finished his career, and now he's just like any other average human being. Does it mean it is compulsory to get depressed in diabetes? No. You can fight head on with diabetes and still achieve everything. I remember there's I think Saina Nehwal. If I'm wrong, I'm sorry. But Saina Nehwal have diabetes and she is on the top. But this doesn't happen with most. And most have a completely change in the trajectory of their goals and life. And their life becomes average. So this was another important complication. I talked about eyes, I suppose. Yeah. Then the frequent infections are the mainstay for diabetes. Frequent infections anywhere and everywhere. It can be urinary tract infection. It can be a simple recurrent viral infections. It can be cellulitis, abscesses. These are so common that this will completely disturb your life. These are so common, as well as it will increase your cost, as well as it will increase your medicine intake. You will think, okay, I am taking only 1 or 2 tablets. No, dear. It will multiply. It will multiply, and more tablets will be added. So take care of diabetes at the right moment. Then there are many autoimmune diseases. Autoimmune diseases and the other diseases of immunity which seem to happen more in the cases of diabetes. One more alert sign. Some drugs have been labeled to be aligned with the risk of cancer as well. So diabetes can lead to pancreatic cancer first. Diabetes itself can lead to pancreatic cancer. Then diabetic drugs can lead to kidney failures and all other complications, including cancer. So pancreatic cancer is one of the not commonest, but one of the complications we get in diabetes. It is yet to be proven that is it a complication of diabetes or is it a complication of diabetic medicines. But whatever it is, both are together. Both will spoil your health together. So guys, please look at something more deeper treatment. Look at something more permanent treatment, and look at something more long-term treatment. But they will say, is there really a solution? Guys, I share so many times. There is a solution. Only thing is that you have to take a responsibility. Once you take a responsibility, there is a solution to work on mind, to work on your internal genetic tendency, to work on the body's immunity, which have made you prone to get diabetes, work on diet. There are so many things we work on. But the most important thing is you need to take responsibility. Now, when I say you need to take responsibility, gear yourself up. Once you gear yourself up, you can take charge. Once you can take charge, just excuse me for a while. Once you take charge, the diabetes can be a history. We have seen so many people reversing from diabetes. Mr. Abhijit, can you please elaborate the entire process of reversal? Abhijit, great question. But let me tell you, this is a very interesting question, Abhijit. Thank you for this question. Reversal will be different in every case. In some cases, during reversal, skin infections may come up for a while. In some cases, diarrhea may come up because whatever you have suppressed will be reversed. For example, if somebody have walked till this, for example, he was healthy here, he walked so many years to become diabetic, he will walk reverse to become non-diabetic. Now, during this journey, whatever he has suffered may get reversed in the same direction, or there can be different process, because now we have developed the techniques by which we can do the shortcut for this step of reversal. We can reverse it much faster. So guys, if you are having the challenge of diabetes, don't just think of control. It's a crime for yourself. Think of reversal, think of cure. I'm talking of complete cure. Now people ask me, so is there a guarantee of 100% cure? Or is there 100% guarantee of cure? I say, what you will prefer? 100% guarantee of complications, which you are having right now, or 70 to 80% guarantee of reversal, which everybody want in life? See, nobody can give 100% guarantee. Nobody ever. Only a liar can give you 100% guarantee. Only a liar can give you. Because nobody is God here. Nobody is Almighty here. Let us be completely open to the idea that we are human beings. I hope everybody believes we are human beings. So my team is also a human being. I am also a human being. We have luckily found, not just luckily, I think saying it lucky will be underestimating our efforts. In 23 years of practicing as a genetically targeted medicine-based homeopathy, we have learned that there are methods to reverse diabetes. Now, 23 years is a huge period. If you want to get the benefit of 23 years, then definitely this is the only way. This is the only way you should treat yourself. Don't just control. You may be saying, maybe even few people are thinking, I am okay with 2 tablets. Why to look for another treatment? What I'll say, look for another treatment so that you do not have to look for another specialist. Now you may be seeing only one specialist. After a few days, you will be seeing eye specialist, a kidney specialist, a sexologist, a cardiologist, a neurologist. See, diabetes is going to take you to all the specialists. Why give a chance? In fact, why take a chance on our own life? You have a better way. Stop controlling, start reversing. Let me repeat it. Stop controlling, start reversing. If you have any questions, I have given a link of booking a free consultation in the title itself. Also, I will be giving my personal email ID to you so that you can write your all the history and my team will get back to you as soon as possible. So I will give the email ID so that you can write it back, because this email ID, I see it personally. So when you write it, I know what you have written. So completely it is going to be between you and me. My team will be there for coordination and helping you in all the processes, right? So guys, here is the email ID I'm writing for you. Write emails on yeah, I've given it here. And consultations. You can book your free consultation and my team will be happy to help you. So guys, thank you for being on this live, watching the video throughout, and save this to as many people as possible so that you can help people get their best life. Just a minute, I will be writing this. So guys, I have sent my email as well as a personal consultation link. It is a free consultation for people all over the world. Anybody from Australia, India, abroad, Los Angeles, or New York, or Dubai, anywhere, anybody can ask for this free consultation. Feel free to share your complaints, share your ideas so that you understand there is something which you do not know. And there is a method by which you can do far, far better in your life. Save yourself of complication, avoid this diabetes risk, prevent this risk right now. This is the best time to prevent because tomorrow can be late. Don't wait for tomorrow. Take your decision, start reversing it back. Thank you. Bye bye. Good night and take care.